Thanks, Lynn. I just want to share that we had our first FLS conference on 20th of October 2022. I'm so pleased and excited to welcome over 200 delegates to our second FLS conference in Wales today. All teams have worked extremely hard. We are very well supported by the Royal Osteoporosis Society. I'd like to thank all our speakers, facilitators, and my Welsh Common colleagues, Gareth, Laura, and Lisa, who have always stood by me. We are particularly privileged to have both the Cabinet Secretary for Health and Social Care and also the Chief Executive of the NHS Wales, Judith Paget, who will be joining us in the next few minutes. We'll be soon hearing from the experts and international speakers. All Welsh Health Board's leads will be reflecting on how we provide fracture liaison services and how we can learn from each other to deliver the Welsh Common commitment for 100% FLS coverage by September 2024 and beyond. And also, especially thank to you, Len, for working behind the scenes on the voluntary basis and supporting us in promoting bone health and osteoporosis care using the social media. I'm very excited and happy and looking forward to meet my colleagues and really grateful and thank you all.
Hi, my name is Peter Carr. I'm the Executive Director of Therapies and Health Science at Aneurin Bevan University Health Board. Really excited to be at the conference today to find out about all the great work happening across Wales to support Fracture Liaison Services. It's an interesting journey and it's great to see how from a small seed we've kind of grown something quite remarkable, and there's a long way to go yet, but already we're seeing early signs of some great improvement and some good outcomes for our patients in Wales, so that's really exciting. I was at the conference in 2022 and there was lots of good ideas there. It's really great that in the last 2 years we've kind of grabbed hold of those ideas and done something with it. You can see it in every health board, actually changes and improvements. That's really good. Still a long way to go, but I think, this is quite an exciting journey, really. Well, I think the ambition is really clear in terms of the target that we need to get to, where we can identify 80% of the patients out there, but also, start treatment for 50% of them. That's the vision, really. If we can get to that, I'd be really pleased, and I'm sure that's the right ambition for Wales. The challenge will be not just getting there, but maintaining it as well. But I think the argument is really strong. I think the value case is really strong. What we've all got to do now is just get behind that and make sure that we present the case really clearly and secure the funding and get on with the job.
Okay, hi there. My name is Dr. Singh. I'm the clinical lead GP for orthopedics in Cardiff, and hence my involvement with the Fracture Liaison team. So I'm actually slightly outside the main workings of the Fracture Liaison team, but trying to facilitate in whatever means possible, mainly through awareness. I get to go through the GP referrals in Cardiff and Vale for a lot of the orthopedic problems, so the hips, knees, shoulders and elbows. And I use that as an opportunity because I see all the x-rays to feed back on the missed possible osteoporosis cases. For me, this is wonderful because there's so many like-minded people. The buzz is very exciting. The fact that the numbers who attended are almost double shows that it is a movement that is much needed and is gathering strength. I think people out there need to know just how important osteoporosis is. We always think of cancer, diabetes and stuff, but this is actually equally important and possibly sometimes as big, if not a bigger problem. So it's really important for people to be aware, self-aware as patients, as individuals, but also doctors, nurses, the whole healthcare community needs to buy into it. So I'm enjoying myself. Lots of fantastic talks so far.
So you're taking lots from here today?
Yes.
Anything new that you've learned?
More than new. One of the bits that was new for me was the speed at which we need to treat to effectively kind of prevent the second fracture or the third fracture. Much of this I was aware of, so it's great reinforcement. But yes, the other bit that I learned today was also how the different drugs work. So again, bit of new learning, lots of reinforcement, all very useful. My phone is full of information I've been typing away. So I think when I go back, I need to digest it all. And the plan is initially to speak to people in my GP surgery, but then try and feed back to people as and when.
Hi, my name is Nia George. I'm a physician associate in orthogeriatrics in Glangwili Hospital in Hywel Dda University Health Board. And I think today I'm going to take back how important it is to have all the funding available to be able to resource all those staff that are desperately needed in our area, but also other areas. I think it's been really interesting what we've learned from the other areas that we could try and do in our area as well.
Hello, my name is Harwoodette. I'm the ward manager of Ward 7, which is a trauma and orthopaedic and hip fracture ward at the Princess of Wales Hospital within Cwmtaf Health Board. And I've come today to the Fracture Liaison Service just to see how I can continue to support managing our patients with frailty fractures and how we can help to develop that service across South Wales so that we're providing the best opportunities for patients to avoid sustaining hip fractures in the future. We did attend the workshop on how to set up a Fracture Liaison Service and how to improve that, so we'll be taking that information back now to the Health Board to see how we can obtain the evidence, and then present that in order to try and get the support that we need to help set it up.
Hi, I'm Gar. I'm a consultant orthogeriatrician in Swansea Bay Health Board. I'm the clinical lead for orthogeriatrics. I've had a really interesting day, really good amount of integration with working with different health boards. I had a very good time running one of the plenary sessions earlier, and it was really helpful kind of showing our model of what we've done and trying to help other health boards in terms of what they might be able to do and taking some early steps and trying to see what they've done. Every health board has been different, and I think that's one of the really key points that take away from today, that what might work where we were might not work somewhere else, but parts of it may help. I think one of the key things that I've learned from today is that all of us are doing the same sort of thing, and they're coming up with similar sorts of challenges. And actually, days like today are really helpful because it gives us the national platform and the national drivers to help direct focus our goals in terms of what we want to achieve. We've all got a similar sort of barriers which we're trying to overcome, and actually I think it strengthens our position being able to come at that from a national perspective rather than an individual trust by trust basis. So I think that's been really, really helpful from today, and I hope that going forward that kind of focus always remains there, because it helps when higher ups, not just within our health boards, but higher ups from a governmental point of view and from a policy perspective, are championing our causes as well. So I think that's been really, really, really encouraging, and hopefully something that we can kind of build on as we try and implement everything that we're trying to do.
Hi, I'm Maricon Fisk. I'm one of the TNO nurse practitioner in Princess of Wales Hospital, and it's a Cwmtaf Health Board. So I've attended last year's as well, and I find it quite interesting. And today I've attended because I want to make sure that we could set up our own FLS, to make sure that patients are looked after, and when they come in with a simple fracture, make sure that we prevent it before they end up having a fractured neck or femur. So that's why I find it make sure that we also disseminate all this information to our health board.
So, as you say, you went to the last conference. Have you seen a change from the last one, how things have developed to today?
We are in the process of developing the FLS, so hopefully we'll make a big change in our health board. And as a practitioner, I also try to see all the patients and try to assess them to make sure that they're also on the right treatment, even though we haven't got a formal FLS service yet.
Thank you.
Thank you.
Hello, my name is Harwoodette. I'm the ward manager of Ward 7, which is a trauma and orthopaedic and hip fracture ward at the Princess of Wales Hospital within Cwmtaf Health Board. And I've come today to the Fracture Liaison Service just to see how I can continue to support managing our patients with frailty fractures and how we can help to develop that service across South Wales so that we're providing the best opportunities for patients to avoid sustaining hip fractures in the future. We did attend the workshop on how to set up a Fracture Liaison Service and how to improve that, so we'll be taking that information back now to the Health Board to see how we can obtain the evidence, and then present that in order to try and get the support that we need to help set it up.
So we attended upstairs with about the primary care, how to manage osteoporosis in the primary care. And obviously it was quite eye-opening, that workshop, and we noted that adherence to this medications for osteoporosis is not that common with the patients. There are so many drawbacks, and how we can improve all this adherence. So I thoroughly enjoyed it. It was really good, and yes, definitely. And also, for the doctors as well, there are not many teaching sessions for osteoporosis, though there are so many teaching sessions for diabetes, stroke, hypertension, how to manage, but with regards to somehow this osteoporosis is lacking. So we need more awareness among the doctors as well as, we need some robust mechanism how to prevent osteoporosis in the primary care. Definitely, yeah. Definitely. And medication reviews are so important, especially for the osteoporosis. We hardly pay any attention. So I think that's what my take home is. Whenever I see a patient for osteoporosis or somebody on osteoporosis medication, so having that little 2 minutes review, how you're getting on with your medications and all that is so important. Yeah.